In today's news, the CCSA says new COVID-19 infections in Thailand could reach 20,000 per day. The ghost ship reported yesterday is now believed to be a smuggler's vessel, and a hospital denies its 39 million person database was hacked. Well, how did it get on the internet then? All this is coming up in today's program. You're watching Thailand News Today, bringing you the latest headlines in Thailand and beyond. And in today's news, the CCSA says new COVID infections in Thailand could reach 20,000 a day if the public does not take disease prevention measures seriously. Sorry, Nanny, we're just trying to get on with our lives here. While 5,400 Omicron infections have been reported across 71 provinces, Dr. Kietipoom Wongcharit from the Public Health Ministry says deaths remain low. Therefore, he suggests that the new strain is highly transmissible but less severe. Kietipoom has outlined 3 possible scenarios envisaged by the Health Ministry. The first and best case scenario is 10,000 new cases a day, with deaths between 60 and 70 a day by late January. The second is between 15 and 16,000 new daily infections. And the third and worst case scenario, in the event that the public refuses to adhere to disease control measures, would be 30,000 new cases a day and around 170 to 180 deaths per day. The ministry expects Thailand's infections to peak by late January or early February in scenario 1 or 2. In the worst case scenario, we would not pass the peak until early March, after which it would take another 3 to 4 months for the situation to be brought under control. However, Kietipoom is confident Omicron will be brought under control within 2 months and that there will be a gradual drop in new cases, with the virus eventually becoming endemic in about a year's time. As a follow-up to yesterday's ghost ship story, an expert has told Thai media that he suspects the mysterious Chinese vessel found in the Gulf of Thailand to have been an illegal oil tanker distributing oil to various countries. The Jin Shui Yuan 2, which many are calling a ghost ship, was reported by staff at an oil rig off the coast of the southern province of Songkhla last Thursday. No one was on board the cargo ship, and apparently no documents or registration numbers were on the vessel either. Only the ship's name indicated that it was of Chinese origin. The Royal Thai Navy attempted to pull the vessel to the shore, but strong winds caused the ship to take on water and sink. The authorities from the 2nd Naval Area Command are standing by, monitoring the engine oil and making preparations to handle any problems that might arise from the sunken vessel. According to the Thai media, one expert in news and national security says that this might have been an illegal tanker. The source suspects that the ship traveled along national water to distribute illegal oil to different countries, including the southern part of Thailand. The ship might have been operating for a long period of time without proper maintenance. If a ship were operating illegally, it would be difficult to find somewhere to dock for repairs. In an initial investigation by the Royal Thai Navy, officers found that a Chinese vessel registered as Jin Shui Yuan 2 was last reported in 2020. According to the website Marine Traffic, the last position of the Jin Shui Yuan 2 cargo vessel was in November 2020 in the East China Sea. The site now says the vessel is out of range. The authorities added that this is the first time Thailand found an abandoned vessel like this one, and there will be a further investigation on the vessel's nationality, where it came from, and find out whether it is illegal. Thailand will ask for international cooperation from Singapore and the US to gather more information and details of the ship. With an uptick in Omicron cases after the New Year's holiday, the country's central bank says the economy might grow slower in the first half of this year. The kingdom had seen a revival in tourism, especially over the past 2 months with the test and go quarantine exemption scheme. However, registration for the entry scheme has been closed due to the emergence of the recently discovered strain, leaving the future of tourism uncertain. Along with the tourism rebound, domestic spending has also supported Thailand's economy. But since the Omicron outbreak, restrictions have been tightened and people have been advised to work at home. The Bank of Thailand says the country is expected to control the spread of Omicron by the first quarter of 2022. But the bank's senior director adds that the outbreak could be more severe and longer than expected. As Thailand's GDP is expected to grow by 3.4% in 2022, households and businesses' financial stability remained precarious amidst high levels of consumer and corporate debt that were also considered a risk. An associate governor at the central bank says inflation is also expected to rise slightly in the first half of 2022, and the bank has been preparing to interfere in markets if the baht currency gets excessively volatile. In what appeared to be the latest breach of the country's public health sector, around 39 million patient records from Sirirat Hospital in Bangkok have been listed for sale on an internet database sharing platform, raidforums.com. The hospital is now denying that its database was hacked. The Faculty of Medicine of Mahidol University, which operates Sirirat Hospital, released a statement saying there has been no data leakage from its faculty or any affiliated hospitals, and that the data set listed was not from the hospital's database. The post on raidforums.com says a sample file of the data is available, which is said to include names, addresses, IDs, phone numbers, and dates of birth. The uploader, who goes by the name Wraith Max, wrote that the price of the data is negotiable and it will only be sold to one customer. The post claimed that the information is not just from the public Sirirat Hospital, but also from VIP records from Sirirat's private hospital located right next door. The majority of public hospitals still lack cybersecurity departments or chief information security officers capable of monitoring threats. The authorities are currently investigating the post on the forum. A sample file can be accessed through Telegram. Since 2020, there have been 3 hacks. All of them have been from the public health sector. The latest data breach was back in October of 2021 when a hacker posted on raidforums.com with over 100,000 patients from 11 different hospitals. Health officials in Phuket say hospital beds are running out as the infection rate begins to climb once more on the southern island. Kukiatgun says that as of Sunday, Phuket has reported 742 new cases. 513 of those are in local residents, with 2 in foreign residents. 133 have been imported by the island sandbox entry scheme, and 94 have arrived under the now shelved Test and Go program. According to the report, over 66% of infections are of the Omicron variant. Gusak says the island is now running out of local quarantine facilities for high-risk groups, and hospital bed occupancy is on the rise. He said during the past 7 days, an average of 340 new cases were detected in Phuket, and the number is trending upwards. Hospital bed occupancy is increasing, and beds are running short, although fatality rates are declining. Meanwhile, the Public Health Ministry has raised the island's COVID alert level to 4. Now, Phuket is a tourism blue zone, meaning alcohol can be sold in SHA-accredited restaurants until 9 p.m. However, people are being asked to avoid high-risk places such as pubs, large gatherings, and places without adequate ventilation. People returning to the island from other provinces after the end-of-year holiday are asked to monitor their health for 14 days, get vaccinated, work from home where possible, and take regular antigen tests. Those who test positive for the virus can dial the 1330 hotline to register for home isolation. After reports that an 8-month-old sick with COVID had to wait in a queue before being treated at a hospital, the government is instructing all hospitals in Thailand to admit child patients immediately, adding that no child infected with the virus should be turned down and staff must have appropriate medication on hand to treat them. The deputy government spokesperson said that Prime Minister Prayut Chan-o-cha has directed the Public Health Ministry to make sure that children affected with the coronavirus are given treatment at public and private hospitals. The statement comes after reports that a couple had problems trying to get their 8-month-old grandson treated for COVID at a hospital. They were seeking urgent care as the child had a fever and low blood oxygen levels, but the hospital staff told the couple to wait in a queue. And that wraps up our report. Thailand News Today will be back tomorrow. Meanwhile, you're now up to date on the Thaiger.